Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to discuss hypoglycemia, including its definition, types, symptoms, treatment, and more. Make sure to watch until the end because there is important information for individuals who are suffering from it or have a family member who is. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is hypoglycemia or low blood sugar? Hypoglycemia occurs when the level of sugar or glucose in your blood falls below the healthy range. Low blood sugar is also known as low blood glucose. Diabetes, particularly type 1 diabetes, is associated with hypoglycemia. When your blood sugar level falls below 70 mg per deciliter, mg/dl, or 3.9 millimoles per liter, mol/L, you have hypoglycemia. For most people without diabetes, hypoglycemia is when your blood sugar level is below 55 mg per deciliter or 3.1 millimoles per liter. Hypoglycemia must be treated right away by eating or drinking sugar/carbohydrates. Severe hypoglycemia can be fatal and necessitates the use of emergency glucagon and/or medical intervention. Low blood sugar is typically caused by an excess of insulin, whether produced naturally by your body or administered. Low blood sugar levels can also be caused by hormonal and metabolic imbalances. When your blood sugar falls below the healthy level, it causes symptoms such as shakiness and a rapid heartbeat, and it can be fatal if it falls too low. This is due to the fact that your brain requires a constant supply of glucose to function properly. Your brain cannot operate if there is insufficient glucose. What signs and symptoms indicate hypoglycemia or low blood sugar? Hypoglycemia symptoms can appear suddenly and vary from person to person. A single person may potentially have distinct symptoms for each episode. Hypoglycemia symptoms are uncomfortable. However, they serve as good alerts that you should act before your blood sugar lowers further. The symptoms are shaking or trembling, deficiency, excessive sweating and chills, excessive hunger, polyphagia, increased heart rate, and feeling dizzy or lightheaded. Confusion, difficulty concentrating, nervousness, irritation, color loss from your skin, numbness or tingling in your tongue, lips, or cheeks. Low blood sugar levels can also occur when sleeping, known as nocturnal hypoglycemia. Symptoms may include insomnia, persistent sweating through your pajamas or sheets, crying when sleeping, experiencing nightmares, tiredness, disorientation, or confusion after waking up. When do the symptoms of hypoglycemia appear? The glucose level at which diabetic symptoms appear varies from person to person. In general, symptoms of diabetes usually appear when blood glucose levels are approximately 70 mg per deciliter or lower. If your blood sugar is rapidly dropping, you may notice symptoms before this point. At comparatively higher glucose levels, some diabetics may have hypoglycemia symptoms. This is due to the fact that when you have persistent hyperglycemia or high blood sugar, your body becomes accustomed to it as its normal level. It changes the threshold at which low blood sugar symptoms appear. Some patients with low blood sugar episodes do not have symptoms or are unaware of them. This is referred to by doctors as hypoglycemic unawareness. People who are ignorant of their hypoglycemia are more prone to have severe episodes and require medical attention. What are the consequences of low blood sugar? Prolonged severe hypoglycemia is fatal and can result in the following complications: failure of multiple organs, arrhythmias of the heart, arrest of the heart, long-term brain damage, coma, death. What causes hypoglycemia or low blood sugar in diabetics? Hypoglycemia occurs when your blood sugar falls below a safe level. Several things can lead to this in diabetics. Hypoglycemia can occur when factors such as diet, activity, and diabetes medications are out of balance. Diabetes patients may experience hypoglycemia in the following situations: taking too much insulin, using the incorrect insulin, or injecting it into your muscle rather than your fat tissue. Incorrect insulin and carbohydrate timing, for example, waiting too long to have a meal after taking insulin for the meal. taking an excessively high or excessively low amount of oral diabetes medicines, exercising more than usual, consuming alcohol without first eating, eating or skipping meals later than normal, failing to balance meals by including fat, protein, and fiber. What causes hypoglycemia in non-diabetics? Non-diabetes hypoglycemia is classified into two types: reactive hypoglycemia and fasting hypoglycemia. Reactive hypoglycemia occurs when you have low blood sugar after eating. It usually happens 2 to 4 hours after eating. The actual cause has yet to be determined by researchers. However, they believe it is caused by a fast rise and subsequent decrease in blood sugar after consuming specific foods, particularly simple carbohydrate items such as white rice, potatoes, white bread, cake, and pastries. In the vast majority of persons who do not have diabetes, fasting hypoglycemia does not result in hypoglycemia. This is due to the fact that your body regulates blood sugar levels through hormones and stored glucose. Certain conditions and environments, however, can result in fasting hypoglycemia in people who do not have diabetes, such as excessive alcohol consumption, critical sickness, adrenal insufficiency, non-islet cell tumor hypoglycemia or NICTH, and insulinoma. Diagnosis and tests. How is hypoglycemia identified in diabetics? The only way to find out if you have hypoglycemia is to use a blood glucose meter or glucometer. The majority of these devices collect a small amount of blood from a finger prick with a lancet, a small needle. Because it may be programmed to notify you to low blood sugar, a CGM known as continuous glucose monitoring could be a useful tool in recognizing and preventing low blood sugar. CGM alarms are especially useful when having a low blood sugar could be dangerous, such as while sleeping or driving. In those who do not have diabetes, how is hypoglycemia diagnosed? If your doctor suspects you have hypoglycemia, he or she may monitor your blood sugar every few hours for many days. Additional testing, such as imaging studies to examine if a tumor is causing the low blood sugar episodes, will be required to discover the underlying cause of the hypoglycemia. A mixed meal tolerance test or MMTT may be recommended by your provider for reactive hypoglycemia. The MMTT begins with a special drink including protein, lipids, and sugar. The drink elevates blood glucose levels, prompting your body to produce more insulin. Then, during the next 5 hours, a clinician will monitor your blood glucose levels several times. What is the treatment for hypoglycemia or low blood sugar? Eat carbohydrates or drink sugar are used to treat mild to moderate hypoglycemia. To treat an incident of mild to moderate hypoglycemia, the American Diabetes Association advises the 15-15 rule. To elevate your blood sugar, consume 15 grams of fast-acting carbohydrates. Check your blood sugar after 15 minutes. If it's still less than 70 milligrams per deciliter, add 15 grams of fast-acting carbohydrates. Repeat until your blood sugar level reaches at least 70 milligrams per deciliter. Read food nutrition labels to find out how many carbs you're consuming. Foods containing about 15 grams of fast-acting carbohydrates include 1 tiny piece of fruit, half a banana, for example, 4 ounces, half cup, juice or regular soda, no diet, 1 tablespoon of honey, sugar or syrup, 1 container of quick glucose gel, follow the package directions, 3 to 4 glucose tablets, follow the package directions. If you have hypoglycemia symptoms but can't monitor your blood sugar, use the 15-15 rule until you feel better. How can I avoid having low blood sugar? Unfortunately, when you have diabetes, it can be impossible to completely avoid low blood sugar. However, you can modify your diabetes care strategy to try to reduce the frequency of hypoglycemic episodes you have. It's much easier to do this if you and your doctor understand what causes your blood sugar to drop. Give your doctor as much information as you can about any low blood sugar episodes. It may be as simple as modifying the times you take your prescription, eat, and exercise to solve the problem. The methods listed below can help prevent low blood sugar. Take all drugs exactly as directed. Follow your healthcare provider's eating and exercise recommendations. Check your blood sugar levels on a frequent basis, especially before and after meals, before and after exercise, and before bed. Write down the details of a low blood sugar incident after you've treated it. Include information such as the time, what you previously ate, whether you exercised, your symptoms, and your glucose level. This can help you and your provider adapt your management strategy in order to avoid future lows. Now, check out this video to discover some helpful tips that will assist you in achieving a healthy lifestyle. Subscribe to the channel to receive regular health tips and advice. That's all for today, and always remember to stay healthy. Thanks for watching, and we'll see you in the next video.